If you have been waking up at night with a burning feeling in the bottoms of your feet, not pain exactly, more like heat that shouldn't be there, that sensation has a specific medical cause, and it is not poor circulation from sitting too long or shoes that don't fit right. It is your nervous system sending you a signal that your blood sugar may have been running too high for too long. Most people dismiss it. Most people are wrong to do so. And the reason I want to talk about this today is that your feet are one of the earliest and most reliable places in your body where the signs of uncontrolled blood sugar show up, often years before a doctor ever runs a test or makes a diagnosis. There are 9 specific things your feet may be doing right now that deserve your attention. Some of them you have probably noticed and explained away. Some you may not have connected to blood sugar at all. I want to walk through each one clearly, tell you what is actually happening inside your body, and give you something practical you can do today, not someday, today. Let me start with why the feet are so vulnerable. Your feet are the farthest point from your heart. The blood vessels that supply them are among the smallest in your body. The nerves that run into them are the longest in your entire nervous system, stretching from your spinal cord all the way down to your toes. That combination of small vessels and long nerves makes your feet uniquely sensitive to changes in your blood. When blood sugar stays elevated for months or years, those vessels narrow, that nerve insulation breaks down, and the damage quietly accumulates. Your feet feel it first. And your feet show it first if you know what to look for. The first sign is tingling, or a pins and needles feeling that shows up uninvited. Everyone's foot falls asleep occasionally. That kind is nothing to worry about. It resolves in 30 seconds once you shift position. But when tingling appears in the morning when you first wake up or settles in at night when nothing is pressing on your leg, that is a different matter entirely. What is happening is that sustained high blood sugar begins to chemically damage the myelin sheath, the protective insulation that wraps around your nerve fibers. Once that insulation degrades, the nerve signals get scrambled. Your brain receives garbled messages and interprets them as buzzing, tingling, or that familiar prickling sensation. Think of a radio signal that is slightly off frequency. The music is still being broadcast, but what you hear is static. According to data from the National Institute of Neurological Disorders and Stroke, between 60 and 70% of people with diabetes develop peripheral neuropathy over their lifetime, and the feet are almost always the first place it appears. What you can do right now, every evening before bed, spend 2 minutes rolling each foot over a tennis ball. Slow circles along the arch and heel. It stimulates nerve activity, improves local circulation, and most importantly, it gets you paying attention to what is actually happening in your feet. The second sign is a burning sensation at night specifically. This is the one that wakes people up. Patients describe climbing into bed feeling completely fine, and then within an hour, the soles of their feet feel like they are resting on a hot plate. They kick the covers off. They hang their feet over the edge of the mattress. Nothing helps. Most people blame their shoes from that day or standing too long. But here's what I want you to understand when the burning happens consistently at night, and it is specifically in the soles. That pattern points to small fiber neuropathy, damage to the thinnest, most delicate nerve fibers in your body. Those fibers do not simply go quiet when they are damaged. They malfunction. They send phantom heat signals. Your brain receives a message that says fire, and it responds as though the heat is real, even though the room is perfectly cool. A clinical review published in Lancet Neurology confirmed that small fiber neuropathy is frequently the earliest detectable nerve abnormality in people with pre-diabetes, sometimes appearing years before blood sugar crosses the official diagnostic threshold. 2 things you can do starting tonight. First, soak your feet in room temperature water for 5 minutes before bed. Not hot, not cold. Room temperature. It calms overactive nerve endings without adding stimulation. Second, reduce your refined carbohydrate intake after 6 in the evening. Bread, white rice, pasta, sweetened drinks. Lowering your evening glucose load can produce a noticeable reduction in nighttime burning within just a few weeks. There are 4 specific causes behind most of these signs, and the third one is the one most people over 60 have never been told about because it involves a branch of the nervous system that controls things you would never connect to your feet. I will get to that shortly. The third sign is a cut or sore that refuses to heal. This one I want to be direct about because it carries the most serious consequences if ignored. When blood sugar is chronically elevated, 2 things happen simultaneously that cripple your body's ability to repair a wound. First, the small blood vessels in your feet become stiff and narrow, cutting the volume of blood that can reach the injury site. Second, high glucose directly impairs the function of white blood cells, the cells your body sends to fight infection and rebuild tissue. Your repair crew exists, but the road to get there is blocked, and half the crew gets stuck before they arrive. The wound stays open. Days pass. It gets worse. The World Health Organization reports that a lower limb amputation occurs somewhere in the world every 30 seconds as a direct result of diabetic foot complications. That is not meant to frighten you. It is meant to make a weekly foot check feel as natural as brushing your teeth. Every Sunday night, socks off, examine every surface of both feet. Between the toes, around the nails, along the heels. Any wound that is not noticeably improved within 5 days is a reason to call your doctor's office the next morning. The fourth sign is skin color changes around the ankles, a darkened, slightly purplish discoloration that most people have seen on themselves and filed away as just a circulation thing. They are partially right, it is a circulation problem, but the question is why. When blood sugar remains high over time, it damages the inner lining of your blood vessels. That lining is supposed to be smooth and flexible, allowing blood to flow freely. High glucose roughens and stiffens it. The vessels in your lower legs, already working against gravity to push blood back up toward your heart, begin to lose that battle. Blood pools. Oxygen delivery drops, the skin, starved of what it needs, changes color. A study in the International Journal of Lower Extremity Wounds found that discoloration of the lower extremities was present in over 40% of patients at the time of their initial diabetes diagnosis, meaning it had been developing silently long before anyone ran a test. What you can do this morning: 3 minutes of seated leg extensions and ankle pumps. Straighten one leg, flex your foot toward your shin, hold 5 seconds, release, then switch. This activates your calf muscle pump, your body's built-in mechanism for moving blood back up from the feet. It requires no equipment and almost no effort. I want to mention a patient briefly because her story is part of why I feel strongly about sharing this. A woman named Gloria, 71 years old, sharp and active, came in and mentioned almost as an afterthought that her feet had been acting strange for a few months, tingling at night, cracking heels that would not heal, a small sore on one toe that had been there for 5 weeks. When we ran labs that afternoon, her A1C came back at 8.2. She had been living with uncontrolled type 2 diabetes for an estimated 3 years. 3 years while the signs sat there quietly on her feet. The fifth sign is dry, cracked heels that no lotion can fix. If you have been moisturizing your heels for months and the cracks keep returning, sometimes deep enough to bleed, the problem is not on the surface of your skin. It is inside your nervous system. Your autonomic nervous system controls functions you never consciously think about: your heartbeat, your digestion, and the moisture level of your skin. A specific branch of it governs the sweat glands in your feet. When high blood sugar damages those autonomic nerves, the sweat glands reduce output or stop entirely. Your feet lose their natural lubrication from the inside out. No cream applied to the surface fixes a nerve that has stopped telling the glands to work. Research published in the Journal of Foot and Ankle Research found that autonomic dysfunction in the feet, measurable through sweat output testing, is present in a significant number of people with prediabetes, sometimes years before a formal diagnosis. For the surface, a urea-based foot cream at 10 to 25% concentration applied nightly and covered with cotton socks is far more effective than standard moisturizer. But the real fix starts with getting your blood sugar checked and managed. That is where the healing actually begins. The sixth sign is persistent swelling in the feet and ankles that does not fully go away overnight. Temporary swelling from a long day on your feet is normal. It resolves while you sleep. But when you wake up and the swelling is still there, when pressing your thumb into the skin leaves a dent that holds for several seconds, that is edema, and in the lower extremities, it is frequently connected to kidney stress. Your kidneys filter approximately 50 gallons of blood every day with remarkable precision. Chronic high blood sugar damages the tiny filtering units inside them called nephrons. As more nephrons are compromised, your body begins retaining fluid it should be expelling, and that fluid follows gravity straight down to your feet and ankles. The National Institute of Diabetes and Digestive and Kidney Diseases states that approximately 1 in 3 adults with diabetes will develop some degree of kidney disease, and lower extremity swelling is often the earliest visible sign. Your action step: reduce your sodium intake to under 2,000 milligrams per day. Read labels on canned soups, deli meats, frozen meals, and condiments. These are where most hidden sodium lives. When resting, elevate your feet on a pillow above the level of your heart. Even 15 minutes produces a measurable improvement in fluid redistribution. The seventh sign is sharp, stabbing foot pain that over-the-counter painkillers cannot touch. Many people spend months or years treating this as plantar fasciitis or a bone spur. They get insoles, anti-inflammatory pills, sometimes a cortisone shot. Nothing works because the source is not in the tendon or the bone, it is in the nerves. When nerve fibers have been injured by prolonged high blood sugar, they do not always go quiet. Some enter a hyperexcitable state. They fire spontaneously without any external trigger. Your brain receives an urgent pain signal and responds as though you have stepped on something sharp, even though you are lying perfectly still in bed. Ibuprofen cannot quiet a nerve that is misfiring at the cellular level. Research published in the journal Pain Medicine found that painful diabetic neuropathy is misdiagnosed as a musculoskeletal condition in a significant percentage of initial presentations, leading to an average diagnostic delay of over 2 years. If you have been dealing with foot pain that does not respond to standard treatments, ask your doctor specifically about neuropathic pain. The treatment approach is different, and addressing the underlying blood sugar issue is essential. A nightly magnesium glycinate supplement, with your doctor's approval, has research support for reducing the intensity of nerve-related pain. The 8th sign is feet that stay cold no matter what you do, not the ordinary cold feet that warm up under blankets. Feet that are cold in the middle of summer, cold under an electric blanket, cold while the rest of your body feels perfectly warm. That asymmetry. Warm body, persistently cold feet is a hallmark of peripheral arterial disease, a condition in which the blood vessels supplying the lower extremities have significantly narrowed. One of the primary drivers of that narrowing is chronic high blood sugar, which accelerates the buildup of plaque inside artery walls. The arteries feeding your feet are among the smallest and most distant from your heart, making them particularly vulnerable. As those vessels narrow, less warm blood reaches your extremities, and the tissue temperature drops. The American Diabetes Association identifies peripheral arterial disease as 2 to 4 times more common in people with diabetes compared to the general population, and cold extremities are among its earliest presenting symptoms. The most effective non-medication response is a daily 20 to 30-minute walk at a brisk pace. Walking physically forces blood into the lower extremities and stimulates the development of new small blood vessels over time. If 20 minutes feels like too much right now, start with 10. Start with 5. If the direction matters more than the distance, the 9th sign is one that almost no one looks for, and honestly, even many primary care doctors do not check during a routine exam. It is hair loss on the feet and lower legs. After you shower tonight, sit on the edge of your bed and compare the hair growth on your upper leg to the hair on your shin, your ankle, and the top of your foot. In a healthy circulatory system, hair grows relatively evenly. But when blood flow to the lower extremities has been reduced for an extended period, the hair follicles in those areas begin to starve. They do not receive enough oxygen or nutrients to sustain growth, and they gradually go dormant. What you see is a visible line above the mid-calf. Hair grows normally. Below it, the skin becomes smooth, hairless, sometimes slightly shiny. It is a reliable visual indicator that blood vessel damage has been accumulating, often for years in silence. A comprehensive review in diabetes and vascular disease research confirmed that hair loss on the lower extremities is a clinically significant marker of peripheral vascular insufficiency with a strong correlation to long-term blood sugar dysfunction. If you notice a sharp decline or complete absence of hair below the knee, book a fasting blood glucose test this week. It is quick, it is inexpensive, and most insurance plans cover it fully. The most important thing I want you to take from everything we have discussed is this. Most of these signs are quiet. They do not send you to an emergency room. They are gradual, easy to explain away, and easy to ignore, and that is exactly what makes them dangerous. Catching blood sugar problems early changes everything. In the early stages, this condition is genuinely responsive to straightforward changes, reducing refined carbohydrates and added sugar, walking daily, getting adequate sleep, staying hydrated. These are not radical interventions. They are choices that are available to you starting today. For Gloria, catching her diagnosis when we did meant that within 6 months of managed blood sugar and consistent daily walking, her foot sore had healed and the tingling had reduced significantly. She is gardening every morning again. Here's the one thing I want you to do before you go to sleep tonight. Take off your socks. Sit somewhere with good light and spend 60 seconds actually looking at your feet. Look for any of the 9 signs we covered. Feel for temperature differences, check the heels, look at the lower leg hair. If anything on this list matches what you see, call your doctor this week and ask for a fasting blood glucose test. That single conversation could redirect the course of your health in a very meaningful way. If you have a parent, a spouse, or a close friend who deals with any of these foot symptoms, burning at night, stubborn heel cracks, swelling that won't resolve, please share this with them. A lot of people are quietly living with early blood sugar problems and have never been told that their feet were already trying to warn them. And if this kind of straightforward health information is useful to you, consider subscribing. I share practical, honest medical conversations every week, and I would genuinely love to keep helping you stay ahead of these things. Before you go, I want to ask you something. Out of the 9 signs we covered today, which one surprised you the most? Or if you have been noticing something in your own feet for a while and never knew what it meant, tell me about it in the comments. I read every comment, and your experience might be exactly what someone else reading this needed to hear today.